Hi, my name is Mina. I'm going to present to you today Healthy Community of Brookfield, a case study, and I'm the executive director, the new executive director, and I'm presenting to you the HCB board of directors. There are certain goals of the presentation. First, analysis of areas of strengths, weaknesses, opportunities, and threats of the HCB, determination of areas of focus in the next 5 years, 5-year plan, propose a new vision and mission for the HCB with a new strategy plan and a budget proposal. Those are the goals of the presentation. What's the overview of the organization? So, HCB, or Healthy Community of Brookfield, is a non-profit organization. HCB was a visiting nursing agency until 1997. Ben volunteered with a sum of $2 million to establish the now known as HCB community. So if we see in Brookfield, 85,000 live in Brookfield. Three quarters, 75% of these people live in the city of Dayton, and the rest live in the rural areas. HCB offers many public programs through a contractual agreement with a county or a state. So one may ask, what are those programs and services? The HCB community consists of a hospital, outpatient offices, county-sponsored visiting nurse agency, VNA, which is short for VNA, a rehab center, nursing home, and skilled nursing facility. So the county also offers some services like Meals on Wheels, YMCA, elder services, regional transportation services, and the United Way. So, what other programs and services, for instance, that the community offers? There are nutrition education for teens, babysitting courses, group bereavement classes, and caregiving support groups, women's health primary care medical services, prenatal and newborn care, mobile health medical services, employee health and wellness services to area employees, case management services for the elderly recently discharged from the hospital, violence prevention programs, smoking cessation classes, diabetes education classes, and teen after school programs, school health, wellness and fitness programs, well water testing and water problem mitigation assistance, vaccine and immunization services. There are some environmental factors and economic factors in the community. We start with the environmental factors. What are the community expectations? So people in general see that this is a good service actually because of the many services of the HCB that the HCB offers. One may think that HCB belongs to the county hospital or county health department, which gives in general a good image and a positive image for the community. And however, it can cause confusion about the programs and services provided. So if someone thinks that it's related to the county or something, that may ask for county related services, which is wrong because of the many services that this community, which we insist that this is a this is a charity organization and a non-profit organization. So that's actually good to make it look like something related to the county, but it's not in reality. What are the examples of the confusion, questions, and concerns of stakeholders? So I am I'm presenting some of the questions that were raised recently. PCP questions about primary care physician questions about women mobile clinics, why private clinics are available. So they're asking why those clinics are offered, those services are offered, while we can go to the private clinics. Other question are law enforcement question about the violence program, diabetes education program for the elderly, which is viewed as as duplication of services. Local farmers are frustrated by the extensive well water testing program. So other duplicate services are after school program and violence prevention program. Um, the increased yearly funding demands are frustrating to the county officials. Though they may ask why. We have to give them the reasons why we're offering those services. Why we're asking, I'm sorry, for those funding and increased funding demands, because we're offering more services to the community which are necessary. The economic forces and political environment. The members of the board believe that the ultimate goal of the organization is to search for funds. A board member clearly stated, apply for every grant possible and see what sticks, twist the arms of the county officials for more funding. Any money is better than no money. So that's the ultimate goal of our organization. Generally speaking, the HCB is a good place to work. However, the organization is described by many as a ship without a navigation system, radar, or sail. So the recently conducted surveys about the HCB show that accreditation standards are not or met, especially Domain 9, which is concerned with the quality improvement plan of the organization. SWOT analysis. SWOT is short for strengths, weaknesses, opportunities, and threats. We're presenting this slide as what are the strengths of the organization. It's a nonprofit organization. It's integral, so provides not only health services but also other community services. Employment friendly environment, serves a big population, and there is a continuous improvement and development of the community. The HCB community is continuously offering more services. That's why we have increased funding demands as well. What are the weaknesses? The funding struggles, unstable employment, unanswered concerns from stakeholders, accreditation standards are not entirely met. Some services are not guaranteed according to the year's budget, and there are some duplication of services of some services. What are the opportunities? There are funding opportunities from other private sources as well as officials. Chances to add more services, chances to cover more geographical areas through mobile clinics, opportunities for better communication through a helpline, internet site for a formal communication and a suggestion or emails. Also, we're presenting the threats. There is a threat of funding cuts from accreditation requirements, threat of interruption of some or all services provided, threats of concerns of some stakeholders, physicians, and farmers to sway people away from the community for leaving bad rumors due to misunderstanding, threats of unemployment of many employees when some services may not be funded anymore. What are the areas of focus to be considered in a 5-year plan? So there are funding, communication, and accreditation standards. Funding depends mainly on accreditation standards, so they are interrelated, which the accreditation standards should be 100% met to get the funding. The only domain not met in the HCB is Domain 9, which discussed quality improvement methods. The quality improvement director, who is the same as the nursing director, will have a big role in strengthening Domain 9 problem. So Domain 9 discusses quality improvement methods which can be achieved by developing a performance management system and executing quality improvement processing. Communication ways are multiple: mass media, interpersonal mass communication, email communication. There is an email inverse importance index grounded theory, which states that whenever an information is important, the more the information is important, the more people will distribute this information. And on the contrary, when more people receive an important communication which is supposed to be important, the less they perceive that this is important, and the less the importance of the information in it. So the less those people are less eager to distribute this information again. What's the current mission and vision of the HCB community? The current mission of the HCB is to promote the community well-being by improving the quality of health promotion through services and education. The current vision statement states that the HCB healthy practices can lead to improved healthy behaviors. Proposed mission based on the 5-year plan focus areas and on the SWOT analysis. What's the proposed mission is that a better communication, including electronic, between employees, stakeholders, and patients will help to improve the HCB picture and role in the eyes of the community and the officials, not only the community. Okay, so what's the proposed vision is that better communication can lead to faster rational decisions and accurate actions which are in the best interest of the community. So better communications leads to better quality improvement of services, which leads to accreditation requirements being met, funding is stable, then employment is stable, and then there is a continuation of the services and the programs offered by the HCB. What is a strategic plan? There is a current strategic plan and proposed strategic plan. A current strategic plan was focusing on getting grant funds to support particular programs. Contracts with the county health department were signed to establish many state-mandated public health programs. The county of Brookfield is also keeping funds each year for health and wellness programs. What are the proposed strategic plans? It's a combination of proper funding, which depends mainly on meeting the accreditation standards, particularly Domain 9 and a perfect communication. Continuous funding leads to continued services and career stability, as we mentioned before. Proper communication between the executive director, fellow employees, board members, and stakeholders will achieve the strategic plan's goals. What are the expenses budget necessary to complete the strategic plan? I proposed a strategic a budget here. For the salaries, we need a new strategic planning consultant to get more funds, and it will cost us $128,000 as an annual salary. This is a proposed salary. Customer service coordinator for the helpline and internet communications. There will be 3 of them initially, and each will cost $35,000 as an annual salary. Equipment and supplies. Computer and connection supplies will cost $10,000, and medical equipment advised by the quality improvement director will be $100,000, and this is the quality improvement, which is the nursing director at the same time. They are the same. Travel expenses are $30,000, and a total of $370,000 annually will be needed as additional expenses aside from the expenses that we already have. The proposed funding, we have the annual funding from the city or state officials. We need more though. The charities, private donations, other resources provided by the strategic planning consultant, so he will find new sources of income. He will work also with the quality improvement director to meet the Domain 9 requirements, which is a main obstacle against this year's funding approval. And those are the references. And thank you so much.